Yep, good. We're recording and everything's on. We kind of have a full room today. We've got Katie and Jane and Ashley, and welcome to our webinar this evening, all about the eyes, which is one of our favorite topics here at Holland Plastic Surgery. We're going to first go over what we're going to go over, and then Katie and I are going to kind of tag team this. We have a patient who's in a live ThermiSmooth treatment that you'll see in just a couple of minutes. And we're just working on the technical aspects here. And then we're also going to treat her with some Botox, so we can show you what that's like. And then we're going to talk about some of the surgical options also for rejuvenation. So everything that we know about the eyes and how to rejuvenate that area is what we're going to do this evening. As usual, any questions, please feel free to ask them as they come up. We don't have to wait till the end. If I'm talking about something that you want to know more about, go ahead and ask. So, maybe someone could answer right now in the question place if they can hear us. If there's any problems hearing or seeing what we're doing, definitely let us know if you would. So here you see our agenda on the first slide. We're gonna do the ThermiSmooth demonstration first. Katie's got that going right now with Jane, and we'll show you that in just a second. Then we're going to go over what skincare products are the best for treating the eye area. And then following that, we will do a live Botox demonstration. We'll talk a little bit about neurotoxins in general, and then specifically show you the areas that we're going to work on for Jane this evening. We'll then talk about some of the surgical options for the area, upper lid blepharoplasty and lower lid blepharoplasty, and then there will be some special savings for the people who attended the webinar that we'll go through at the end. And again, questions, feel free to ask questions at any time during this procedure, during this webinar. So we're going to go to the live of the ThermiSmooth face demonstration. And you can see that Jane's having it right now. There is a wand with a smooth metal tip that's delivering the radiofrequency energy to Jane's skin. Radiofrequency in general is used to stimulate collagen. The Thermi platform, we use the radiofrequency for skin tightening on the surface, as you're seeing with Jane today. It can be used to treat around specifically at the upper and lower eyelids, as well as around the mouth. It's the same technology that we use for vaginal rejuvenation and also for the Thermi tight of the face and neck. How it works is by delivering the radiofrequency energy to the skin. You can see Jane's skin is pinking up really nicely. She's getting some reaction to the energy that's being delivered. And that activity is stimulating her collagen. It's something that after the treatment, she'll be a little bit smoother, a little bit puffier, and then she'll start to see the improvement over the next 4 to 6 weeks. This is a treatment that takes about 20 to 30 minutes if we're doing the eye area. And after 2 to 4 treatments, people see a nice difference in that smoothing and tightening of the skin around the upper and lower eyelids. It's a relatively comfortable treatment to have. Occasionally it's a little bit zingy. There is some energy. You can see Katie's moving the wand pretty quickly, and that's to make sure that not one area gets too hot. So she's keeping Jane nice and comfortable. And she's treating all that skin right around the eyelid. You can see that it makes Jane's eyelids wink a little bit, and that's from the nerve activity that's in the area. So it's stimulating kind of all those tissues in that area. But it's really relatively relaxing to have. You can be treated as frequently as every 1 to 2 weeks. And again, optimal treatment is 4 to 6 treatments. So that's the ThermiSmooth. And while she's finishing up the ThermiSmooth, I'm going to just show a couple of pictures of patients who've had this treatment. And you can see the tightening that's been achieved in the skin around the eyelids just with three treatments. And it just really does a nice job in that thin skin around the upper and lower lids. Second patient over here. You can see improvement of both the lower lid, kind of the lateral lid, and then the upper lid. So it can be used safely in all of these areas, and can be used for the whole face and around the mouth, but really what we're focusing on now is how good it is for treating the periocular area. any treatment that we do, the name of the game is collagen stimulation, and that's what this radiofrequency treatment is all about. You can see Katie's looking at the screen, and the reason she's looking at the screen is to see what heat she's delivering to the skin, and also what temperature she's heating the skin to. So she's moving the probe carefully, but she's also making sure that she's giving an adequate treatment. We want to make sure we're getting enough temperature in, and also not so much that we're making Jane too uncomfortable with the treatment. So that nice kind of pink warm reaction is what we're looking for, and you can see that she's getting her nice and warm in that area where she's treating her. So while Katie's finishing that treatment, I'm going to start talking about some of the skincare products that we find most useful for the skin around the eyes. These are some of our favorites here. The Youth Essentia Vitapeptide, this is an eye gel treatment by Environ that's used to stimulate collagen. I'm going to just quickly go to a slide that shows a photo of what we expect. This one on the top right here, the before and after. This is one of the photos that when I originally saw it made me use this product twice a day, every day. So it is really good at smoothing that area around the eye, helping with fine lines and wrinkles, stimulating collagen growth, and really creating a nice smoothing effect. The second one that I'm going to talk about is the TNS eye repair, and this is kind of, I feel like this is the gold standard for someone who's my age. I used to say that Elastoderm was my favorite eye cream. This trumps Elastoderm for me. It's a treatment product, as well as it makes the skin of the eyelids feel and look really good while it's on. So in addition to the growth factors that are stimulating collagen, it's smoothing the skin and making it nice and glowy for even a day at work. So treatment and smoothing and moisturizing. It's the TNS eye repair. A couple other products. One is the HA5 from Skin Medica. It can actually be used over the whole face, but particularly good about stimulating hyaluronic acid production. So not just delivering hyaluronic acid to the skin, but also improving our endogenous hyaluronic acid production. So using this, you get the delivery of the protein in the product, but then also stimulating your own production, so that you're kind of doubling up on that and making things nice and smooth and hydrated. And finally, the TNS Essential Serum, which again can be used all over the face, but specifically for the eye area. The growth factors are increasing that collagen growth and improving the appearance of fine lines and wrinkles, and making the area much smoother. One of the products I don't have in my on my little desk here is Latisse, which is an enhancement for eyelashes. Also, it works really well for eyebrows. Many people experience some thinning of the eyebrows with aging, and Latisse can be used both on the eyebrows and on the lid lashes. It's used nightly with a small little brush, just one little drop right along the lash line, and people start to see results at 3 to 4 weeks. Some people ask, well, what happens when I stop using it? You're not going to lose anything, but you certainly lose that stimulatory effect. You're not going to end up behind. You're only going to be ahead with the addition of the lashes that you get with Latisse. And I always think Latisse there's an interesting story to tell about it, that how it was discovered is it's a medication that was used to treat glaucoma patients, and glaucoma patients were coming in with their eyelashes touching their glasses and asking their optometrist and ophthalmologist to trim their lashes. And so that's how it was discovered and became FDA approved for lash growth. There are quite a few eyelash enhancement treatments on the market now. Latisse was, one of the first FDA approved treatment for this. So it's been used in thousands of patients, and the outcome studies are good. These are photographs of what you can expect from these treatments that we're talking about. And here's an example of what you can expect from the TNS Essential Serum. So just after 1 month of use, you can see that the skin looks more well hydrated, that the fine lines and wrinkles are dissipating, the skin is softer. I already showed you this one of the Vitapeptide eye gel, similar with the HA5 rejuvenating hydrator. Again, it's bringing hyaluronic acid to the skin, as well as stimulating your own hyaluronic acid production. And finally, the Latisse, which 16 weeks later, you can see that her eyelash volume, length, and color has practically doubled. So that works incredibly well to enhance the areas around the eye. So when Katie's finished the ThermiSmooth, she's working on Jane's left side right now. She's almost finished that. Then she's going to go over some of the aesthetic treatments that are enhancements to the eye area, specifically the lash lift, which gives the appearance of much more fuller, smoother lashes. And then a lash and brow tinting, which is quite added value to the overall aesthetic. And finally, brow shaping, that kind of keeping your brows groomed and the hairs healthy really helps with the overall aesthetic of the face. So Katie's going to go over how she performs some of those procedures. So I'll leave these pictures up here for now. And she'll talk about these, and I'm going to get Jane ready for her neurotoxin injection. That's the next step. So Katie will be right with you. We're just changing positions here, changing the guard. I can clean that up. Okay. Okay, perfect. All right.
All right, hello everyone. So just a few aesthetic treatments which are fun and comfortable, so to speak. They can really make the eyes pop a little bit. Eyebrow waxing, we use a hard wax here, which is very gentle on the skin. You always want to make sure you stop any retinol use about a week prior to a wax to make sure that the skin does not have any irritation. But an eyebrow wax can really help open the eyes and just give a nice frame to the whole eye area. In addition to an eyebrow wax, we can always add a little tint to your brows and your lashes, which again just really helps make that area pop. And it's especially great for summertime when you're at the beach or if you're on vacation and you don't want to have to worry about mascara. Also, a little brow tint is always nice. You don't have to worry about using an eyebrow pencil. It just helps fill in that eyebrow area. Tint lasts for about 3 to 4 weeks, and we do have a variety of colors. The treatment only takes about 15 minutes, so pretty quick and easy. And lastly, our favorite eye aesthetic treatment in the office is our lash lift. That takes about an hour, and it is essentially a perm for your eyelashes. We apply a little silicone rod at the base of the eyelashes and wrap the lash around with glue, a glue that comes off easily with water. We use 2 different setting lotions to help keep that curl in place, and the lashes will stay curled for about 6 to 8 weeks. The day of treatment, you want to make sure that you don't wear any eye creams, any mascara, and you don't get the lashes wet for a good 24 hours to really make sure everything sets. But the result is beautiful, and again, great for vacation or really just any time. It's nice to wake up in the morning and see that your eyelashes already look fabulous without mascara. You can add mascara if you like, but you certainly do not need to. And that's pretty much it for our eye treatments. Dr. Holland's just about ready with her injectables.
Who was getting that ThermiSmooth treatment a couple minutes ago. And she's had neuromodulators before, and the areas that we concentrate on her, you can see if she frowns really big, these lines here bother her. as well as these lines over here. If she raises her eyebrows up all the way, you can see she's pretty soft from prior Botox treatment. So we're going to really focus on the areas that are wrinkled right here. But in general, I think of neuromodulators mostly as for the upper third of the face. We're trying to open up the eye aperture, raise the eyebrow, decrease the glabellar lines, or what's traditionally been called the 11s, and then the forehead lines. And I think the important thing to note about neuromodulators is some people are afraid of not being able to have emotion or show any expression, and it's dose dependent. That earlier we were talking about what's the average dose for a patient. If we're treating all those three areas, so between the brows, elevating the brow, and the lateral brow area and the forehead, it's probably about a 40 unit injection. Anybody who's new to our office for a neuromodulator, we see you back at 2 weeks after initial treatment to make sure that you've achieved the results that you're looking for. We can't take it back out, but we can always add it on. So in someone who's concerned about having not enough movement, we can certainly start small and add on to achieve the desired result. So it's not kind of an all or nothing. You don't have to erase every last wrinkle. It's really to be used where your specific concern is. We definitely have patients who are only concerned about their glabellar lines, which would be right here. Some patients only want their crow's feet treated and their brows elevated. Other people don't want to have any wrinkles on their forehead at all. So it can really be modulated for any specific patient. The other thing about it, there's a couple different products on the market. We specifically have the Dionne and Botox. They're both a botulinum toxin. They work in the same way. How the neuromodulators work is actually by preventing the nerves from talking to the muscles. The muscles in the face, and especially around the eye, are very thin layers of muscles. And there's little tiny nerve fibers that give those muscles the message to contract. When we contract is when we create those wrinkles. And so the purpose of the Botox is to prevent those nerves from talking to the muscles, which decreases that muscle fiber activity. So we're just trying to soften that activity. By softening it, we can open up the eye area, elevate the brow, and decrease their lines on the crow's feet, or also in this area here. Botox can also be used occasionally for the lower face. Sometimes people have very strong upper lip lines. If they're Jane doesn't have any, but if she did, it can be a way to soften upper lip lines in patients. Sometimes people have a dynamic muscle down here in the chin that can kind of create a little funny fold or wrinkle there. We can improve the shape of the smile with small doses of Botox around the mouth in that area. So it is kind of used in a lot of different places, but the main purpose is to relax those muscles. So today we're gonna just treat her around her eyes, a little bit of her glabella and her forehead. And she'll start to see results somewhere around 3 to 4 days. At the time, about 2 weeks is when we expect everyone to have received their optimal results. And that's why we do the follow-up at the 2-week mark. And again, it's not that everyone has to come in. Jane, we've been injecting for a long time, so we know what to do and what you're gonna need. And so we don't have to follow up with her 2 weeks. But the first time, I think it's nice when someone's brand new to Botox or new to this practice, it allows me to see how their muscles are going to respond and what their actual dose is, because we all have kind of different amounts of muscle mass. And I would say, 9 times out of 10, we get it right at the 2-week mark and we don't have to do anything else, but it does allow us to add on if we need to. So she's already been cleansed, and we just treat the skin with alcohol. And I inject with a 32 gauge needle, which is a tiny, tiny needle that we get from Japan, because the smaller the better, less chance of bruising. And you'll be able to see actually where the fluid is that goes in. She'll have a little tiny bit of swelling in the area where I put the fluid. Here we go, little pinch. And then a couple units go in there. And the injection here is for the crow's feet and to open up the eye aperture. The muscle, there's this broad circular muscle that goes all the way out around the eye called the orbicularis. And the purpose of that muscle is to close this whole area. And by relaxing that muscle, we can open up that area. And again, how many units we need is really dose dependent on the person and how extensive their muscle fibers are. So we're going to do the same thing on this side. Just get a little bit in that orbicularis muscle. You see just a little bit of fluid under the skin that will go away in the next 10 minutes. Some people ask about activities, what can you do and can you not do after Botox? Really, the only thing you can't do, I would say, is yoga. You don't want to be face down, or a massage. You wouldn't want to put your face into a face cradle and put any pressure on the area that's just been injected. But other than that, there's no limitation. There's no limitation in activity. Nothing special that Jane has to do. Just let it work. Now we're going to go for her 11s. And again, you can see I'm just going right for where that muscle bulk is. And everyone's anatomy is a little bit different. And that's the key, is just to notice where the most activity is. The neuromodulators that we use, Dionne and Botox, we find that they both have a very similar duration of use. We have noticed that Dionne, the onset is a little bit quicker, so people may notice it working in 2 to 3 days rather than 5 to 7 days. But the duration of treatment is very similar. The number of units are the same, whichever treatment you're using. And we're just going to put a little tiny bit in her forehead. So her forehead looks pretty darn good. While she's here, we might as well get it all done. Keep you all even. And that's it. And she can, wash her skin just like normal. She can put on makeup if she wants to before she leaves. Use her sunscreen. Again, nothing that she has to avoid. Bruising can happen with Botox. It happens about 10% of the time. With fillers, it happens more like 50 to 60% of the time. It really depends a lot, I think, on diet more than anything else. And that obviously is changing from time to time, but we have a list of things to avoid to help with decreased bruising. We also use arnica. Starting that 2 days before any injection really helps decrease the bruising. If you do have bruising, then we recommend that you take that 3 times a day until the bruising is gone after. Just while we have Jane sitting here, we're going to talk about this again later, but I thought I would mention Bellaterra, which is a filler that can be used in the lower lids. Jane's not the best model for this because she's got really good lower lids, but some people develop like a kind of a little tear trough area here, and sometimes it looks like a little bit of a dark circle and a little bit of absence of volume. And this is a really great place to put a little tiny bit of Bellaterra, filling kind of this trough here. Again, Jane doesn't have much of one, but some people can really use a nice filler in that area. So that's the area that we talk about when we use a filler in the lower lids. And I think in my hands, Bellaterra gives me the best, kind of smoothest result for that. So that's an area for filling, and we'll go over that on the other screen in just a minute. Thank you very much.
Thank you.
Okay, so we're back. Any questions about any of the things that we've talked about so far? So we've gone over the aesthetics, we've gone over neurotoxins, we've gone over the 30 Smooth. Bellaterra is the filler that I was just mentioning. Someone just asked, how long does Bellaterra typically last? That's usually around 4 to 6 months. I can tell you I've had it, and mine was definitely more than 6 months ago, and it's still durable. at this point because it's not a super dynamic area. It lasts quite well. It's a hyaluronic acid, which is similar to many of the fillers on the market. If you've heard of Juvederm or Voluma, Restylane, they're all hyaluronic acids. How we choose one material versus another has to do with how thick or how thin they are. They're cross-linked in a variety of different ways, and the higher cross-linked tend to be thicker and more durable. The lower cross-linked are thinner, softer, but a little bit less durable. In the eye area, we want something that's soft and also something that's not hydrophilic. The molecules of hyaluronic acid, why they work so well for fillers is that you get the immediate volume from the filler, but they also attract water molecules. And you can imagine the lower lid, you don't want to overfill that area, and having something that can kind of shift with your hydration is not a good idea. So Belotero does a really nice job of filling the area. It's not quite as hydrophilic as some of the other hyaluronic acids. So it can be really helpful for the lower lid area if someone's not ready for a surgical procedure and has some loss of that tissue in that area. So that's a filler. These are just some pictures. This is obviously Katie, for those of you who know her. And this is after a neuromodulator treatment. You can see how this area has changed substantially after 5 days. So this is just 5 days later, and it's already softened that area. You can see that her brow position is elevated and her eyes are a little bit more open. This is a picture of the Belotero. This is immediately after. So what we were filling is kind of this area right here, where you can see a little bit of shadowing. There's kind of fullness above it and shadowing below. So one of the questions is is there typically more bruising with Belotero? This is pretty typical, although since this picture, I'm now using a cannula, which is what I use for fillers everywhere else. So I put a little numbing right here where you see this mark, and then a cannula is used to fill this area. So at this, so we no longer see these little marks. But that's kind of what can happen. Unfortunately, with any filler, bruising is the most unpredictable thing. We had a patient who's a regular filler patient this week, and she takes 4 or 5 days off of work because she just really bruises badly with every injection. And this week she didn't bruise at all. She has now 4 days free, and she was so excited about it. But it's she was having a cheek filler, and it's unpredictable. I think depending upon how much what your vitamin supplementation is, what your diet's been like, if you've had red wine, and there's a really long list of things that can affect that bruising, and it definitely makes it a little less exciting the day that you have it. If there is bruising, it doesn't affect the duration of the treatment or the effectiveness, but it certainly is not that much fun when you have a big bruise. So as you can see, she has a little bit of marks from the needles from where the filler is. But even immediately after the procedure, this darkness is smoothed out and removed. And now for the surgical options. So the most common is upper lids. That tends to bother people more than the lower lids because the upper lids can start to feel heavy. Some people complain that they are having trouble with their upper, with their mascaras getting on their eyelids, or that they feel like that their eyelids are heavy and hooded. So the goal of upper lid surgery is to get rid of excess skin, and sometimes that can improve vision in someone who's having a whole lot of excess skin, and it also can help with the extra areas of fullness that as we get older, our tissues get a little bit lax, and the fat pads that are normal to have there protrude a little bit. So sometimes on an older person, you can see a little bit of fullness in that little medial quadrant of their eyelid. That can also be addressed with upper eyelid surgery. And in lower eyelids, sometimes it's a skin problem, but often it's dealing with that line that we showed for the Belotero injection. And it's redraping the fat that's in there to make things appear smoother and more youthful, as well as addressing any excess skin. These are just some pictures for me to describe a little bit. Anyone who's been in here for an eyelid consult, I always draw a picture of this line of where the incision is. When this is all closed up, it's a line that nobody's going to be able to see. It's about 7 centimeters above the eyelid at the level of the pupil, and it extends laterally and medial to get rid of extra skin. In addition to when we're in there, in addition to the skin, we can address any issues that are happening with the muscle, any issues that are happening with fullness or excess fat. And that's the procedure for the upper lid. The lower lid can be done in a couple of different ways depending upon the main concern. If it's a younger person and they don't have skin excess, but they're complaining of either these kinds of lines or bags, sometimes it's actually just an incision that's done on the inside of the eyelid. And with an incision on the inside of the eyelid, this excess here can actually be moved down to here to smooth out this junction between the eyelid and the cheek. The lid cheek junction, if there's more volume here, like we showed with the Bellaterra, you can actually use this volume to fill out that deficit, and that's a large component of a lower lid blepharoplasty. So it's not always this external incision. If someone has a whole lot of extra skin, then yes, some of the skin has to be removed, but often it's more managing the fat pads and this tear trough deformity. A long time ago, people would do upper lid blepharoplasties and remove all of this fat, and we now know that that's not the way to make someone look more youthful. That really we're all fighting to keep our facial fat as much as possible. So the goal is to keep what we have and just reposition it to make the lid junction look more youthful. Any other questions about procedures or techniques, or I guess I could talk about the recovery from lid surgery. If you're having just upper lids or just lower lids, it's something we can do in the office under a local anesthetic. It's remarkably well tolerated. It's easy to numb the area. Patients are very comfortable being awake and having the procedure. The reason for going to the operating room if we're doing uppers and lowers is just the amount of time on the table is uncomfortable for people. The stitches come out at 5 to 7 days, and after 5 to 7 days, there's no limitations in activity. So that skin is quite thin and it heals rapidly. The bruising can be significant, and the bruising can last 7 to 10 days, but the skin actually heals quicker than the bruising resolves in most cases. So our special savings for this evening, there's 15% off any of the skin products that we discussed today. So the Vitapeptide Eye Gel, the TNS Eye Repair, the Skin Medica HA5, and the TNS Essential Serum. So 15% off of all these products, and $10 off of any of the aesthetic treatments with Katie, anything that we talked about this evening. The ThermiSmooth that you saw with Katie and Jane, a package of 4 is $1,400, and with that you will get neuromodulator treatment for $12 a unit. Usually our usual price is $15 a unit. So you'll get a savings in your neuromodulator. Obviously those two treatments go really well together, addressing the skin envelope and the musculature underneath at the same setting. Really improves the appearance around the eyes. Finally, any of the surgical procedures that we've talked about, you would get a $250 discount by mentioning this presentation. As always, this webinar will be has been recorded, and it will be on our website, so you can access this material at any time. Any specific questions about savings or booking, you can address Ashley at hollandplasticsurgery.com. Any questions, if you email them to info@Holland Plastic Surgery, then I can answer those even after this webinar if something comes up and there's something more that you want to know. So with that, I think we've done it. All right, thank you very much for joining us this evening. Have a good night.